My name is Nicole Diefenbacher, and I am the Social Media and Communications Coordinator here at Vibrant Emotional Health. As part of our ongoing series, Mental Health Matters, we've been chatting with different people from different communities about mental health within that community. Today, Dr. Anitha Iyer, Director of Behavioral Health Population Management at Mount Sinai and Associate Professor of Psychiatry at the Icahn School of Medicine at Mount Sinai, is here to chat with us. How are you, Anitha?
Doing well. Thank you for having me.
Thank you for talking with us. So I guess the first question I have for you is just to tell us about yourself and your work in the mental health space.
Sure. So as the Director of Behavioral Health Population Management at Mount Sinai Health Partners, I focus on our behavioral health strategy for integrating behavioral health throughout primary care. It's a really important need, particularly now with all of the strains that COVID has presented, because we know that the mental health epidemic that this is going to set off is going to be with us for a while. And places where people are already seeking care, in particular with their primary care physicians, it's a really important place for us to build behavioral health strengths. So that's sort of in large part what I do.
That's awesome and really important work. Thank you. So my next question is, why is it important for us to talk about mental health, especially for the Asian American community that isn't a monolithic group at all?
Yeah, it's really important to note that right at the outset when it comes to the Asian American community. Something that sort of complicates our understanding systemically of the Asian American community is that data in the census and sort of any other place in public documents where people indicate their ethnicity, the option for Asian Americans is often in this category called Asian and Pacific Islander. Right, about 23 million, roughly it's about 7% of the population identify as Asian American or Pacific Islander. And as you said, that includes a really wide swath of individuals, people that trace their roots from China, Taiwan, Japan, Korea, to India, the Philippines, Vietnam, Thailand, Singapore, Hong Kong, but also Hawaii and Guam. And people often sort of feel like, do I really fit in this category? And so a lot of times Asian Americans may also select other as their race. In fact, I can speak for myself. Sometimes I've selected Asian Pacific Islander, and sometimes I felt like, I don't know, does that capture me? And so it's a wide group, and it's not a monolith, like you said. Linguistically, there's tremendous diversity within the Asian American category of people, right? So there's about 100 languages that are spoken within the various Asian American Pacific Islander groups in the US. Geographically across the country, there's quite a bit of diversity, right? So the Asian American community is largely concentrated in California, New York, New Jersey, Texas, Illinois, and so on. But obviously there are pockets of Asian Americans in other parts of the country as well. And then there's a wide income diversity in this group, right? And this is a really key area in understanding the Asian American community, because on average, Asian American household income levels tend to be higher than non-Asian American household income. And that tends to drive a lot of the stereotypes around Asian Americans as well. But about 11% of Asian Americans in the US live below the poverty line. And that's actually higher than for white Americans, where about 9% of white Americans tend to live below the poverty line. So that sort of is an important piece to understand in Asian Americans as well. And there is a related impact on insurance, right? So almost 75% of Asian Americans have private insurance, but about a quarter of Asian Americans are on public insurance, and about 7% are uninsured, right? And that proportion of uninsured Asian Americans is higher than among white Americans. Now, all of these factors are really key to understanding mental health in the Asian American community, because as we know, it is these sorts of social determinants of health that make or break healthcare in general, but in particular, mental health care, right? So if you are Asian American and you're seeking care, but your insurance doesn't cover it, or you don't have insurance, you're not able to find a provider who speaks your language or understands your culture, and doesn't understand really how to separate you from this large group. Those are all factors that could discourage Asian Americans from seeking mental health care.
Yeah, I thank you for sharing that. So my next question, in addition to what you were just talking about.
Yeah, Asian Americans experience a wide swath of mental health concerns. But the mental health concerns in Asian Americans really needs to be interpreted in the context of sort of cultural factors that prevent or discourage help seeking. So some statistics on that are sort of important to know, right? So about 2.7 million Asian American Pacific Islanders report having a mental health or substance use disorder. And within that, about 5% of Asian Americans report having a substance use disorder, which compares to as less than their white counterparts or the general population, which stands at about 8% prevalence for substance use disorders. Now, again, it's really important to interpret this statistic in the context of underreporting and underdiagnosis, right? So folks may have mental health and substance use concerns who are Asian American who don't seek help. When they seek help, they don't report symptoms with the same level of specificity because of concerns about stigma and such. And then on the provider side, there isn't perhaps as much cultural awareness of factors that interfere with the provider's ability to diagnose mental health and substance use concerns accurately in the Asian American population. So an HHS report, again, provides some really notable statistics. So in 2017 report from the HHS noted that suicide was the leading cause of death among Asian Americans as a group. However, the overall suicide rate in Asian Americans is about half of white Americans. Similarly, Asian American girls in high school age, so grades 9 through 12, were about 20% more likely to attempt suicide than their white counterparts. Now, when you consider those statistics in the context of the underreporting, which I noted earlier, it's really alarming when you think about sort of folks experiencing severe mental health concerns and suicidality. But sort of if that's the number we know about with all of the underreporting, what's the real prevalence rate, right? And then SAMHSA released a report just last year which notes that Asian Americans receive mental health care, including prescription medications for psychotropic medicines, at about 1/3 the rate of their white counterparts. And so again, right, interpreting that statistic in the context of underreporting and underdiagnosis. So just because that's the rate at which they receive the care doesn't mean that's the rate at which they need to receive the care.
That's a really, really interesting insight. Thank you. So my next question for you is, what can allies do to help support the mental health of Asian Americans in their lives?
Yeah, it's really important for those who have Asian American friends, family members, neighbors, colleagues, students, supervisees. If you're concerned about someone, it's really important to educate yourself about the cultural factors and the barriers to care seeking that exist within Asian Americans as a group. And that is the case for any subgroup, right? And most of us belong to multiple subgroups, and we know the unique barriers and the unique cultural factors that prevent any of us from care seeking or interfere with our abilities at care seeking. And we know that other groups and other folks have similar challenges. So we owe it to ourselves and our communities to educate ourselves about various subgroups, and Asian Americans are no exception. And so some that are important to know, as I've noted earlier, are sort of linguistic and cultural competence and the lack thereof, or the perceived lack thereof, among providers. So it may be that we have friends that we care about who are Asian American who even acknowledge that they're experiencing depression or anxiety or post-traumatic stress, and they're really going through a low, particularly now, right? In the effect of the pandemic has been significant increases nationally in depression and anxiety, to the order of about 3 times as much as the last year. So if we have Asian American colleagues or friends who are reporting concerns, it might be helpful to check in with them about whether they perceive that should they seek care, they wouldn't find someone who would have cultural congruence and would understand their cultural needs, or that they may not find someone who speaks their language and perhaps they're most comfortable conversing about emotions in their native language, right? Similarly, it's important for those of us that work in healthcare as well as in fields that overlap with healthcare to really be aware of the prevalence of misdiagnosis and underdiagnosis by providers, particularly when those cultural factors that mitigate care seeking and the expression of symptoms are not very well understood. So if we have friends who are Asian American who are seeking care, it's helpful to sort of check in with them about, do you have a therapist you feel comfortable with, and you do feel that your therapist or your psychiatrist is able to understand you and are able to fully grasp what it is that you're experiencing. And sometimes talking through that way may help our friend or our colleague convey their needs more accurately. It's important to also understand that Asian Americans have, sort of strong expectations to keep matters within the family. There's a significant amount of pressure around that. So as an ally, it's helpful to not push. We don't want to try to force someone to speak to us if it's so ingrained to not do so, and to really just create the space so they're aware. And really knowing that shame about mental health and shame around care seeking is a very strong emotion in Asian American communities, again, because of a culture of sort of keeping information private and being respectful of that, but finding a way to relay again that sort of, I'm here for you when you're ready. Knowing that support from family members for mental health care can often be inadequate among Asian Americans because of the same factors I've been talking about. And so being aware of that and knowing that as an ally, one should expect themselves to be willing to go a little bit further. And then a really important piece to bear in mind for those who are concerned about an Asian American friend or family member about their mental health is that studies show that psychosomatic complaints are more prevalent among Asian Americans, meaning psychological symptoms that are manifest through physical symptoms, unexplained stomach pains, unexplained chest pains, sometimes unexplained gynecological symptoms, and really just knowing that, if your friend or family member is reporting symptoms that are somewhat, abstract and difficult to peg physiologically, may be helpful to encourage them to talk to their primary care physician or whomever they are going to seek care medically about their psychological needs as well, so that we can help our friends and family members bridge those barriers.
So my next question for you is, what can mental health professionals do to better support Asian Americans, and what resources are available for Asian Americans who are looking for support?
Yeah, again, it's quite similar to what allies, would need to be mindful of, really understanding those cultural factors, particularly the elements of shame at needing mental health support, shame at care seeking, and the expectation to keep information private and to not sort of betray your family trust by speaking to somebody outside the family, and really being aware that psychosomatic complaints are more prevalent, that psychological needs are more likely to present as unexplained physical symptoms, are all important components for providers as well, right? In addition, I think providers need to be aware that there is this sort of likelihood of misdiagnosis or underdiagnosis, and knowing what types of symptoms to look for so we don't miss important elements. For example, there are some studies out of India which show that women in rural parts of India report actual discharge, like gynecological discharge, as the only symptom of sexual assault, because it is so shameful to talk about having been assaulted. And then the host of sort of traumatic stress response that come later are often more readily manifest as sort of unexplained gynecological symptoms. And so being aware of that, educating oneself, and knowing to ask questions very specifically in ways that we may not otherwise feel the need to ask. And that may sort of involve going above and beyond typical screening instruments and such, which tend to be more aligned with DSM-5, symptomatology checklists and such, and that don't have the space really to pull for these more subtle, more nuanced symptoms.
Okay, absolutely. So then my last question for you is, if there was one key fact that you'd like people to know or one myth you could end about mental health, what would that be?
I think it's really important, whether we're talking about ourselves, friends and family, or patients in our care, to really sort of emphasize that mental health doesn't look the same in everybody. And with Asian Americans in particular, because there tends to be such community level expectations for success, particularly academic and vocational success, people often assume that you're fine because you are highly educated, and you are getting, you have a well-placed job and you are sort of gainfully employed. However, underneath that, there are layers of sort of pressures to keep your pain and your needs private, which may not manifest in the same ways that we tend to think of sort of symptom-based assessments and understanding of need. And then I mentioned earlier sort of that statistic that that small proportion, 11%, which isn't a small proportion, but that proportion of Asian Americans who are living below the poverty line, who don't fit this kind of, successful subgroup myth that exists. And then that puts them at greater risk of being overlooked and not really seen for the needs that are prevalent in that group. So, it's really important, I think, to keep an open mind, and when working with someone, to really evaluate that individual's needs on a one-to-one basis.
Thank you for sharing that. It's really interesting, all the things that you've said today. I really learned a lot. And thank you so much for talking with me today. If anyone has any questions about this video or topic, please feel free to ask in the comments below, and we'll be happy to connect with you. Be sure to follow us on Twitter, Instagram, and Facebook at Vibrant for All, and keep an eye out for more videos like this one. Thank you so much again, Anita.
Thank you. It's my pleasure.